This is Shadow, a senior chocolate Labrador dog. He's been fighting to survive Librela, a drug that was supposed to ease his arthritis pain but caused serious side effects. Now, Zoetis is launching Lenivia for dogs and Portela for cats. They promise up to 3 months of relief from osteoarthritis pain, a longer-acting alternative to Librela and Solensia. But before you trust the hype, here's what you need to know about these drugs, their trials, and the risks. Lenivia, izenivetmab, is a canonized monoclonal antibody designed to relieve osteoarthritis pain in dogs with a single injection lasting up to 3 months. Portela, relfovetmab, is a felinized monoclonal antibody for cats, also designed for up to 3 months of pain relief. Both are part of a new generation of NGF-targeting therapies, essentially longer-acting versions of Zoetis' earlier drugs, Librela and Solensia. Their mechanism is the same. They block nerve growth factor, a protein that tells the brain a joint hurts, reducing the sensation of pain. Lenivia and Portela were studied in clinical trials designed to measure both effectiveness and safety. Lenivia, dogs, evaluated in 2 exploratory dose studies and a pivotal placebo-controlled trial, with a primary endpoint at 90 days, plus a longer 9-month field study. Portela, cats. Tested in a 9-month field study in Europe, including cats with kidney disease stages IRIS 1 to 3. The most common adverse effects reported in trials were, for Lenivia, injection site pain, lethargy, decreased appetite, vomiting or diarrhea, temporary weakness or ataxia, increased thirst and urination. For Portela, injection site pain, dermatitis, pruritus, scabs, or hair loss. Regulators classified serious events as rare, but these were observed in controlled, limited populations, not in the millions of pets treated post-approval. Because Lenivia and Portela work exactly the same way as Librela and Solensia, the types of side effects are expected to be the same. The only difference is the longer duration, which could make side effects persist longer or appear over an extended period. This means that the risks we've already seen, from mild injection site pain to more serious reactions, could occur again. We've already seen reports of severe adverse events and deaths with Librela and Solensia, so the potential for serious reactions is very real. Clinical trials are small and selective. They usually exclude older, sicker pets, the very animals most likely to receive these injections in the real world. That's why post-marketing surveillance matters. Every adverse event, even temporary reactions, should be reported to your veterinarian and your national regulator. These reports are what help protect future pets and can lead to label updates, warnings, or safety alerts. If your vet recommends Lenivia or Portela, ask about alternatives and the potential risks. Understand what side effects to watch for. Have a clear plan for immediate veterinary care if your pet reacts badly. And please, report every suspected adverse reaction. It could save another pet's life. Lenivia and Portela may be marketed as new drugs, but under the surface, they're the same drugs with the same risks as Librela and Solensia. For Zoetis, this is a product launch. For families like ours, it's personal. We want transparency, we want safety, and above all, we want our pets, like Shadow, to survive.